Hey everybody, Judy Seeger here, your host for the Frontier 3 Ozone Conference coming up in Santa Barbara, California. Very excited to have you here because today we're having an interview with the founder and the actual conference host, Dr. Mark Weiser. Dr. Weiser, thank you so much for being on here today.
Yeah, thanks for having me, Judy. Appreciate it.
Yeah, and we're going to get into all kinds of cool stuff about the conference today, so I'm excited about that. But here's the thing, that those of you who are watching the interview, that Dr. Mark Weiser is a biological dentist, but cosmetic dentist originally, and had 39 years in the dentistry field with over 14 years with ozone therapy. So another well-experienced physician that's going to share some things with you, and to understand that his heart is really to help biological dentists to move forward and get this information into their hands, into their practice. So Dr. Weiser, thank you so much for being on here again and being able to share this. So you're originally, you started 39 years ago as a dentist.
Right.
What made you change or decide that you wanted to incorporate ozone therapy into your practice?
In 2002, I heard Dr. Julian Holmes at a dental meeting talk about this new procedure and substance that he was using, and I just found that intriguing. At the time, I was at the height of my cosmetic dental career, and I was looking for something different. I was making everybody look good, and now I just want to make them feel good. So we kind of are branching off in the biological dental world in addition to the cosmetics. And ozone is just a natural fit.
Yeah, for sure. And so as you incorporated it, did you see that it was difficult to incorporate? I mean, was there a lot of changes that needed to be made? And how did your patients respond?
It's probably about one of the easiest technologies I've ever introduced in my practice. It's a quick learning curve. The equipment is relatively inexpensive in the dental terms, and it's very beneficial for just about every procedure that we do in dentistry.
Yeah, and what kind of results are you getting with the patients?
Well, for example, if you treat a herpetic lesion on the lip, we're getting resolution within 48 hours, whereas previous medications have side effects and that cut the duration was nowhere near the healing time that the ozone does. So that's one example.
Yeah, sure. And then why would you encourage the biological dentists to incorporate ozone therapy into their practice?
Well, some of the biological dentistry involves minimally invasive dentistry. Tooth enamel is very sacred, so we want to remove as little as possible. And with ozone, we're able to remineralize some of that decay, so we don't have to drill as much of the tooth away. So ozone's very effective in caries management and also gum disease too.
Yeah, that's a big issue with dentists. There's constantly an issue with infections and gum disease and
Right.
using that. So let's talk a little bit about the conference, because you're really the one that's put this together. And I know you have tried to put together other societies and things to help the dentists, but this is really taking off in a big way. It's the third conference, first of all, right?
Correct, yes.
And it's growing by leaps and bounds, which is exciting. And you're having speakers come from all over the world to speak
Everywhere.
about ozone. Yeah, it's crazy. I've been interviewing doctors from Italy, Brazil, Mexico, and of course all over the United States. So it's very exciting. What is your, in getting these speakers, what is it that you're trying to accomplish with getting the different speakers to teach the doctors?
Yeah, well, every year we're trying to do something different. Just to, there's not a big ozone user market out there. So we want to introduce either new speakers, new topics, and have something that covers the range from the veterinarians, the healthcare, the dentists. Everybody gets a piece of new information there. So we're trying to do that. There's kind of three emphasis to this conference. One is we want to make sure that, number one, the fellowship is incredible with this. You're in the room with 200 like-minded ozone enthusiasts, and you're sitting next to some of the experts in the whole world. So that's very encouraging. But one of our themes is oral systemic link, any kind of bacteria and things going on in the mouth certainly can affect the body, and vice versa. So we want to kind of not have the dentist be so isolated, not have the physician be so isolated, but to have them merge in the information exchange of how the oral cavity can affect the systemic body. So that's one emphasis. The second emphasis is always having something for the newbie, the new person involved here in dentistry and healthcare. So we have a whole day. The first day is all introduction, either to medicine with Dr. DeLuca from Brazil, dentistry with Dr. Dome and Mahalka. They give a nice comprehensive overview of how to introduce ozone to your practices. So it's great. And for those who don't want to do that, their third room, we're having advanced presentations, and that's pretty much all new research that's coming out in ozone. So that's the first day.
Oh, wait, don't keep us in suspense. What's the second and third day?
Well, the second and third days, we have 3 modules. There's a healthcare room, there's a dental room, and a veterinary room. And everything is concurrent meetings, and we have researchers, clinicians going over all the different protocols and things we're using ozone for in our specialties. And so one of the themes there is like, well, I like what's going on in room A, or I like what's going on in room B, and I can't be in 2 places at one time. So we do have a special going on, an early bird special for those who want to sign up before August 15th, that if you come and sign up the early bird, we're going to give you a free set of conference tapes, which is going to include the medical section, healthcare section, the dental section, and the vet. So you're going to get the whole conference, even though you can only be in one place. So that's a little bonus we're throwing in.
That's a huge bonus. That's actually a very big bonus, because that way, that's what I always worry about conferences, is missing one class when I'm at the other one, and it's very frustrating. So that's a huge bonus. So the ozonetherapiesgroup.com is where they get registered. So if you want to get this big bonus, which is fantastic, that they don't have to miss anything at all.
Nope.
It's just all they have to do is go to the link below, ozonetherapiesgroup.com, and register now, register early so they could get that bonus. So that's great, Mark. What else do you have?
Well, on the second and third days, we have our keynote speakers that are coming in from all over. Lambert Ray, Eugenie Nazarov's talking about, he's from Ukraine, talking about ozonated saline, which is kind of a hot topic now. And then we have Dr. Robert Walker from Mexico now. He's talking about the oral systemic link was one of our themes. So we have a lot of great keynote speakers that are going to enlighten us a little bit. And these are all people that after they talk, we can have individual conversations with them. It's real nice, close-knit fellowship group. So I encourage everybody to come.
Yeah, for sure. And the venue, let's talk a minute about the venue, because it's breathtaking. I love Santa Barbara. I haven't been back there for years. Yeah. It's in California on the coast. And there's a little cute little town. They could go walk around, go to the beach.
Yes. The venue is at the Veterans Building, which is right across the street from the sand on the ocean, between the harbor on the right and on the wharf on the left. The view is incredible. It's an area that we had our difficulties this year with the wildfires and the mudslides, but that was in areas other than the actual city itself. So that everything is perfectly ready to go. It's beautiful. It's almost distracting, the location.
I know. It's like, oh, should I go to the class or should I go to the beach, right?
It's too nice of weather. It's people are just stopping at the front door and looking which way to go. So we have some nice social events. The social events, the first night we have a wine tasting out on the wharf. It's a real nice Conway family wines, and it's real nice. That's where you get some real nice fellowship on. And then the second night at the Maritime Museum at the harbor on the other side, great room, has good objects to look at, and we have catered dinner and speakers talking there as well. That's
fantastic. So what I'm hearing you say is, first of all, you're going to have some great speakers come from all over the world to share their findings. You're also going to have speakers who are going to introduce using ozone therapy into their practice. So if they're new to it, they could certainly learn a lot from that, especially that first day. So that's exciting.
And one more thing.
Yeah, go.
This is the first year we're really, okay, so we have all this great information. How are we going to make it work in our practice? So we have a certain segment of the program where we have people like yourself to say, how do we how do we get the Ozone people to see us or recognize us or know that we're even here? So bringing new patients in, which I'm happy that you're coming to speak to us about. And then we have other speakers that are going to say, well, how do you find good team members in your
in the office? Yeah, it's huge.
And then, how do you make money at it? So
we're going to be covering a lot of that. Yeah, the branding, the marketing, the office, keeping, once the patients come in, how do you keep them?
Correct.
Yeah, you're one of the few people at these conferences who's covering that, and that's such an important issue.
Right.
I'm a naturopath from 30 years, closed my clinic a few years ago, and so I work only online, but that was always the main issue, is how do you get more patients and how do you keep them? So that's fantastic.
So important.
Yeah.
And yet nobody's addressed it. But, you know, it's, you know, we like the science part of it, but we also got to make it work in our everyday lives. So.
Exactly. So that's fantastic. So again, all they have to do to get the early bird special with your, is it DVDs going to be, Mark, or how's that going to work?
They're actual thumb drives that I send out.
Oh, thumb drives. Excellent. So that's even easier. My gosh, it's just put in your suitcase and you're done to go. So ozonetherapiesgroup.com, they could register before August 15th to get that special bonus. That's fantastic. But if they don't, I mean, it's still a win-win situation. You got 3 fantastic days with fantastic speakers. You're going to be there. You're speaking also, Mark?
No, I'm not. I'm just going to be, I'm too busy.
You're running the show, of course.
Yeah, this one I'm not. So.
Okay. But you'll have vendors there as well, so they could see some samples and that.
We only have like 15 vendors, and they're going to be representing of the different aspects of Ozone, from the equipment to the supplies, products, and then supportive type of therapies.
Which will be nice because they could see firsthand what the equipment looks like. They could ask questions,
and
they could ask questions.
They're in the same room as the main room, so it's real good for interaction there. You know, you may see someone talk about something, then you can just walk 20 feet to the vendor booth and say, well, how does this work? So and
that's fantastic. Yeah. So it's a lot of rubbing elbows together and sharing information. And that in of itself is invaluable from people who are in the know, who've been doing this yourself for many, many years. Right. Excellent. Excellent. Thank you so much, Mark, for sharing and giving us your time. And those, again, who'd like to be at this fantastic conference, go to ozonetherapiesgroup.com and sign up. And we'd love to see you there.
Yeah, we would. Thank you very much. Appreciate it.